Hi, welcome to episode 8 of OSCE with Mudau ES. Today we will be doing offering of a bedpan or urinal. This procedure is about providing the appropriate equipment for the patient to micturate and or defecate. These include urinal or usage of bedpan. As part of standard precautions, always start with washing your hands to prevent cross-infection. To make sure that you get cooperation and participation, kindly greet your patient, introduce yourself and your assessors. For you to get consent, briefly explain the procedure that you are going to do to the patient, the reason for you to do that procedure, and immediately after that, you may ask for consent. Assess the patient's condition to identify a need for elimination. In addition, check the immediate environment for the patient to make sure that you maintain safety and clean environment for the patient. To comply with hospital policy, make sure that you identify the patient correctly. For this procedure to be effective, you're gonna need a plastic apron to protect yourself. You're gonna need gloves to prevent cross-infection. You're gonna require a bedpan or urinal and a cover to make sure that the patient can defecate or micturate in one of them. Provide a toilet paper for wiping after the procedure. A bowl with warm water for the patient to wash the perineal in your assistance or by themselves, and also a paper towel to wipe their hands when they are done. To prevent cross-infection, decontaminate or wash your hands, and thereafter wear your protective personal equipment, which include your goggles if need, your gloves, and your apron. To ensure that the right procedure is done to the right patient, properly identify your patient to comply with the hospital policy that states that all patients admitted should be identified from admission up until discharge. In addition, make sure that you check your prescription as prescribed by the doctor, as it is a critical point. To maintain patient's privacy, make sure that you close the door if it's a room. Screen the curtains around the patient if it's inside a cubicle. Assist the patient to get into a comfortable sitting position, and also assist the patient to lift the buttocks in case where there is no monkey chain. In addition, help the patient to lift the buttocks or herself to make sure that you can position the bedpan on the buttocks. Allow the patient to move the legs slightly so that the bedpan is well positioned. When comfortable position is maintained or achieved, please leave the patient alone inside the curtains or the room so that the patient can have privacy or self-esteem. Provide and or offer a toilet paper so that the patient can be able to wipe after passing stools. After the procedure, make sure that you bring washing equipment near the patient. Assist when necessary to make sure that they clean the perineal area using warm water and soap. This is to maintain personal hygiene. In addition, offer a bowl of water for the patient to wash hands after cleaning the perineal area. If by mistake the patient has wet both the bed and his clothes, please make sure that you give them clean ones and change the bed linen. Make sure that you straighten the sheets and rearrange pillow. This is to allow comfort for the patient. Carry the bedpan and urinals to the sluice room. Before you dispose, inspect the characteristics of the urine. Also inspect the output volume and also inspect the characteristics of the stools. Thereafter, you can dispose safely in the sluice room and leave the urinal and the bedpan in the washer. Remove all your personal protective equipment that includes plastic apron, mask and gloves, and dispose them accordingly. For prevention of cross-infection, please make sure that you wash your hands with soap and water. For your evaluation part, make sure that you check that the patient is comfort. Ensure that side rails are actually raised for patient safety. Recording is very important. Record urine output as you've discarded and also the bowel action. Record everything you've done according to the principles of record keeping, and thereafter report to the medical supervisor or the shift leader of the day for any abnormalities observed.